How long have you worked here?
6 years.
And what were you doing before this?
I worked in the bone marrow transplant department.
Here.
I'm a coordinator for the department, clinical coordination.
What do you like best about your job?
I just like working for the department in general. I've worked with different clinics over the years, and one thing that's interesting about working for the neurosurgery department is that you guys, neurosurgeons in our department, don't really take it as much as a career as it is a lifestyle. You guys are here all the time. Like when I get here in the morning, you're here, and when I leave at night, you guys are still either in the middle of a procedure or doing something. And it's weird because it doesn't feel so much as work as it feels like just trying to keep up with you guys. And mostly like working with the patients. You guys deal with a lot of people who are either frightened or in pain. And typically in my role, you guys do the surgeries, the nurses talk to the patients, but as part of the first line of communication for a lot of patients, we get to kind of clarify a few things just to talk to them, just to make them feel more comfortable. With a lot of times there are important things that you guys are doing that the patients aren't even aware of, and they being able to communicate to them, yes, we definitely are working with you, and we understand what you're going through. We're trying really hard to do this. If they don't hear that, sometimes they don't think it's happening. And so and I would have to say Dr. Abash, but at the same time, it's also one of those things where she's funny, but she's definitely serious in terms of, like, if she feels that you were in a barrier to her patient's progress at all, you better run. You'd better get out of the way because she will let you know. And I mean, all of you guys are kind of like that. I mean, you don't like feeling somebody got in the way of patient progress, or patient care at all. And if there's a barrier, you guys go through it instead of around it. So a really nice patient of Dr. Haynes, that she was very complex, has a lot of different issues going on, but she was also very nice, and so she would call, and she immediately would recognize my voice and be like, "Oh, Matt, hi," and when she came once, and she called me down to the clinic to give me a hug, and I'm not a hugger, so it was but it was very sweet to know that she cared as much, and she gave me her son's graduation photo and everything, and it was cool to know that something I did meant that much to her, that